Hello and welcome to the Next Opinion, where we cut through the confusion in pain care and deliver real, actionable insights for patients, providers, and anyone who's tired of cookie cutter advice. I'm your host, Dr. Jim Dalfino. I've spent 25 years helping people find relief from pain without surgery, and today we're talking about one of the most exciting and misunderstood tools in modern care, which is known as Class 4 laser therapy. Now, if you're new to this world, laser therapy might sound like it's one of those trendy treatments you see in magazine ads where some miracle cure that promises the moon but never quite delivers. I get it. There's a lot of noise out there, but there's what I want you to take away today. Laser therapy isn't hype, it's a powerful, evidence based way to help your body heal itself naturally and safely. And it's changing the lives for people just like you. Let's rewind just a little bit. Laser therapy actually has roots going back over 50 years. In the 1960s, a Hungarian scientist named Andrei Meister was studying how lasers could destroy tumors in mice. The funny thing is, he didn't destroy any tumors that day. Instead, he noticed something else. The hair around the laser site grew back faster and the wounds healed more quickly. That was the birth of what we now call photobiomodulation, using light energy to spark natural healing in the body. Since then, technology has come a long way. Early lasers were low power, cold laser systems, and they were great for surface level injuries, but not much help for deep muscle or joint pain. Class 4 lasers, which we're talking about today, changed the game by delivering higher energy safely into deeper tissues. That's what makes them so powerful for things like arthritis, sciatica, disc issues, and even older injuries that never quite healed. But let's be real. Just because something has a history doesn't mean it always is used right. I've seen places that overpromise and treat laser therapy like it's a magic wand. It's not. But when used correctly by providers who know what they're doing, it can be a key piece in your healing puzzle. Let's break down exactly how this works because it's more than just a fancy flashlight. Your body is made of trillions of cells, each one with tiny power plants inside called mitochondria. When you're hurt or dealing with inflammation, those mitochondria can get sluggish. They don't produce enough energy, and healing slows down. What laser therapy does is flood those mitochondria with light energy, helping them produce more ATP, which is the fuel your cells need to repair themselves. Think of it like jump-starting a car battery. You're not replacing the engine, you're just giving it the jolt it needs to start working again. Laser therapy also triggers something called vasodilation. It opens up blood vessels and it improves circulation. That means more oxygen, more nutrients, and more building blocks to get to the area that needs it most. It also has an anti inflammatory effect, almost like a natural cortisone shot, but without the side effects or the risk of tissue breakdown. For my patients, what this feels like isn't a big aha moment in one session. It's more like layers of healing that build over time. Each session is a brick in the foundation, helping your body work the way it is supposed to in the first place. I hear a lot of the same questions from patients who are thinking about trying laser therapy. And honestly, I love it because it means you're curious, not just blindly buying in. Let's walk through some of those questions. Is it safe? Yes, when used by trained providers, Class 4 laser therapy is very safe. There's no downtime, no cutting, no injections. The worst I've seen is mild soreness in the area we treat, almost like the good kind of soreness you get after a workout. Will it hurt? No. Most people say it feels like a warm, gentle tingle. It's not uncomfortable. In fact, a lot of people find it relaxing, especially when they've been living in chronic pain for years. How long does it take to work? Great question. I always tell patients healing isn't a one-shot deal. Most people see improvement after 3 to 5 sessions, but real lasting changes usually need quite more. Some can be upwards of 8 to 12 sessions, depending on how severe and, of course, how long standing that problem is. Why haven't I heard about this before? So, this one's interesting. The truth is, laser therapy has been in the sports world and specialty clinics for decades. But it's only in the last 10 years that it started to reach more mainstream pain care. So insurance doesn't always cover it, and because it's newer to the average patient, there's still some skepticism. And that's why I love talking about it, because once you understand the why and how, it stops becoming some fancy gadget and starts being a real tool in your healing toolbox. Let me share a few stories that I think really bring laser therapy to life. Let's talk about George. George has spent 40 years in construction. He's bent over concrete and carrying heavy loads all the time. By the time he retired, he could barely make it through the grocery store without leaning on a cart. We started him on laser therapy, and about after 6 sessions, he told me, Doc, I'm sleeping through the night again. There's no more knee pain waking me up. And that's not just about pain, it's about getting his life back. Let's talk about Maria. So, Maria, she's in her 30s. She's a mother of two, and she has sciatica. Now, her sciatica was so bad, she felt it was like fire down her leg every time she tried to bend over and pick up her baby. She was so tired of pills that didn't work, tired of doctors saying, just wait and see. Well, laser therapy helped calm that nerve down so she could get back to being the mom she wanted to. And last, we'll talk about Jake. So, Jake is the guy who wanted to get back on the soccer field. He had hamstring strains that were still nagging him for months after an initial injury. Laser therapy didn't make him a pro athlete overnight, but it helped break up the scar tissue, improve blood flow, and get him back to the game that he loved. Now, each one of these stories is different, but what they all have in common is this: laser therapy gave them a way to move forward when they felt stuck. All right, let's talk data, because I know there's always a healthy dose of skepticism, and honestly, there should be. There are plenty of so called, quote, miracle treatments out there that don't stand up to real science. But laser therapy, yeah, this one does. A 2017 meta-analysis in the journal Medicine reviewed dozens of studies and found that laser therapy significantly reduced pain and improved function in people with musculoskeletal injuries, things like back pain, arthritis, and even tendonitis. A 2020 study in Lasers in Medical Science looked at patients with knee osteoarthritis. These are people who've been told get a knee replacement or live with it. After a series of class 4 laser treatments, they had less pain, better mobility, and were taking fewer medications. Another 2022 review in the journal Curious showed that laser therapy could be a safe and effective conservative treatment for lumbar disc herniation, those nasty disc bulges that send pain shooting down your legs. This isn't a placebo effect. There are double-blind studies, real-world data, and real changes in how people move, feel, and live. And here's something else that I want you to know. Researchers are looking beyond just pain relief. They're exploring how laser therapy can stimulate nerve regeneration in people with neuropathy, how it can speed up wound healing in diabetics, and even how it might help athletes recover faster after injuries. So yes, while it's not a magic bullet, it's one of the most well-studied, evidence-backed options for people who want to heal without relying on opioids or going under the knife. This is probably the most important part of our conversation. Laser therapy works best when it's part of a bigger picture. I always tell my patients, imagine you're building a house. Laser therapy is like the foundation. It helps your tissues heal and calms down the inflammation. But you still need the walls and the roof, the exercises that rebuild stability, the healthy movement patterns, the nutrition, and all of it that supports your joints. That's why in our clinic, we combine laser therapy with things like spinal decompression, which takes pressure off nerves and creates space for discs to heal. We may do corrective exercises to retrain your body and to prevent the pain from coming back. We may even do posture and movement coaching, because if you're hunched over a desk for 8 hours a day, no laser is going to save you alone. But when we layer these treatments together, we see people not just getting out of pain, but staying out of pain. And that's what I'm always after, not a quick fix, but a real solution. 3 questions I have that you should ask before starting treatment. If you're ever thinking about laser therapy, here are 3 questions you should always ask the provider you're thinking about working with. What kind of laser are you using? Number 1. See, not all lasers are created equal. You want a class 4 laser, not a cheap class 3 cold laser. Class 4 goes deeper and does more. There are a lot of class 3 lasers on the market and in healthcare, and many of them are marketed very strongly to providers as being the best that there is. Don't get fooled. How does this fit in with the rest of my care? Is question number 2. If they're treating laser therapy like a standalone cure, that's kind of a red flag. You want to make sure that that provider sees a bigger picture. As I mentioned before, laser therapy is just not a one and done type of treatment. Question number 3, what kind of results can I realistically expect? If someone's promising you'll feel 100% better in one session, run away. Healing takes time. Good providers will set honest expectations and track your progress. Remember, the best results come from teamwork between you and your provider. Laser therapy is a tool, it's not a magic wand. So here's what I want you to take away from today. Laser therapy is safe and evidence-based. It's not voodoo. Laser therapy works at the cellular level, helping your body heal naturally. And last, it's not the only piece of the puzzle, but it's a powerful one. If you're listening right now and feeling stuck, maybe you've tried everything else. Maybe you're tired of the same old take a pill and wait routine. I want you to know there's always another option, and laser therapy might be that next step for you. Of course, talk to a qualified provider, someone who will really listen to your story and create a plan that's tailored for you, not just a cookie cutter protocol. Because at the end of the day, your pain is personal and your recovery should be too. If you need recommendations in your area of a provider that can give you that type of option that you're looking for with class 4 laser, feel free to get in contact with me and I'll be happy to do the research for you and give you the names of a provider in your area that I believe would be best suited for you. If you've enjoyed today's deep dive, I'd love to have you join our newsletter, The Next Opinion. Every week, I share real patient stories, the latest breakthroughs in non-surgical care, and honest conversations about what works and what doesn't in the world of pain relief. You can find us at www.thenextopinion.com or just thenextopinion.com. And as always, thank you for spending this time with me. Remember, you're not alone, and there's always another opinion worth hearing. Stay strong, stay curious, and I'll see you on the next episode.